All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening, dear friends. I am Jessila Mujib welcoming you to a brand new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. Your health is our concern. So in each episode of this talk show, we bring before you an expert doctor from Al Hilal Hospital to address your various health related queries and concerns. We are having summer in this part of the world. We know the scorching heat of summer causes skin diseases and other infections, and profuse sweating favors the spread of infections. To discuss about this subject, we have with us Dr. Reshma Thomas from Al Hilal Hospital, Hith. She is a dermatologist, and let's move on to the doctor and know more about the subject. So doctor, welcome to the show and thank you for joining us today.
Thank you. So happy to be part of the team.
Our pleasure, doctor. So doctor, what are the common skin infections found during summer?
Okay, so the thing is, the skin changes with seasons. So the winter is a time where, because of the dry weather, it strips the moisture from the body. Whereas in summer, due to sweat retention, moisture retention, there is more chance for infections like fungal infection, bacterial infections and all. So the most common, as we all know, fungal infection, fungus, it grows well in the moist, wet areas on the body. So it appears as round, circular, red patches with peripheral scaling. It's more over the sweaty areas, including inner thighs, under breast. It also can occur any part of the body, even in children. and all. So it's very important to have a proper hygiene. Like we have to take shower at least once daily, but if you sweat a lot, need to take shower at least 2 times daily. If you can, if it is possible for us to use like any sulfur soap or antifungal soap like ketoconazole soap, that will be always good. And if the fungal infection, like if there is only 1 or 2 patches, it will be better with application of topical creams like clotrimazole, miconazole, gluconazole, terbinafine. Many topical creams are there. But these days we are seeing many patients with resistance to fungal infection. So this is because of the over-the-counter use of many steroid creams. Okay, so the steroid creams, when they apply, they get much relief of itching, the redness and all will be reduced. So they may feel that fungal has subsided. But the thing is, the fungus is growing, it is growing deep under the skin. So it becomes more resistant. So in that case, we always need to start some oral tablets, antifungal tablets, and it's always better to use plain antifungal cream rather than the mix of cortisone and antifungal cream. So the tablets, the problem with the fungus is that we may have to take tablets maybe for 2 to 3 months. So some fluconazole, 1 tablet is there, it is given like weekly. Other tablets like itraconazole, terbinafine, it has to be taken for 2 to 3 months sometimes. And in those with diabetes and with immunosuppression, sometimes the treatment course may be a bit prolonged. And even after stopping the tablets, one may have to continue using the topical creams because there is every chance for recurrence in fungal infection. And coming to, and always when a person gets infected with fungal, always use separate towels, separate soap, wash his clothes separately, not to apply any oil, moisturizer, especially over the affected area. So all these measures has to be taken care of. And coming to the bacterial infection, the common bacterial infection occurs maybe by the occlusion of the hair follicle due to the sweat retention, to the rubbing of the area and all. It's called folliculitis. And if it's a very few folliculitic lesions are only there, we can go for topical antibiotic cream. And if multiple lesions, you have to consult dermatologist, need to take oral antibiotic tablets along with topical antibiotic creams. And if one is getting recurrent bacterial infection, recurrent these pustules and all, sometimes we may have to take pus culture so as to find out which type of bacteria is causing and which antibiotic has to be started. So, and also in summer climate, we get more of exacerbation of the underlying skin conditions like worsening of acne, worsening of rosacea, exacerbation of pigmentation, melasma, and as you all know, we get a lot of allergic reactions with the sunlight.
Can you please explain some of the safety measures to be taken for the skincare?
Okay, yeah. As I told you, like proper cleansing is very much needed. 2 times take shower if you sweat a lot or at least once daily. Also cleansing, along with the cleansing of body, cleansing of scalp, cleansing of face is needed. If we have any dandruff issues, itchy scalp, have to use antifungal shampoo 3 times in a week or 2 times in a week. If you have an oily skin, you have to use the face wash containing salicylic acid or glycolic acid. You can use 2 times daily or 1 time daily. If you have a dry skin, you can use a mild, gentle cleanser. Along with that, we have to use sunscreen. As we all know, sunscreen is very important. And at night, even for the oily skin and dry skin, it's always advisable to use a good moisturizer. So in case of oily skin, use a moisturizer of gel preparation or fluid preparation. And whereas in dry skin, you can go for a cream, moisturizing cream. So coming about the sunscreen. So why we should use a sunscreen? That's a usual question we get. For that to understand better, we need to know what are the harmful effects caused by solar radiation. The solar radiation that reaches the earth is mainly of ultraviolet. Ultraviolet itself is of 2 components, UVA and UVB. So 95% of ultraviolet that reaches earth is UVA and UVB is just 5%. Though it is just 5%, it is the one more powerful than UVA. It is the one that directly damage DNA, that can cause skin cancer, or like in acute stage, it can cause sunburn, redness, allergic, sunburn, not allergic reaction, sunburn. Whereas UVA, it can penetrate deeper into the skin, and it is the UVA that cause allergic reaction, immediate tanning of the skin, and also it can also contribute to aging of the skin and cancers of the skin. So when we select a sunscreen, we have to check whether it gives a good protection from both UVA and UVB. So the thing, one may be only looking SPF.
Yes.
So what is SPF? It just means protection from UVB. It doesn't specify UVA protection. So SPF 30 plus is always recommended. 30 plus, it gives 97% of protection from ultra UVB. When we go for higher SPF, sometimes sunscreen application will be like, it may be a bit sticky, it may not be comfortable with those. So it is better if you can use SPF 30, it's good, it's well and good. Okay, so always go for a broad spectrum sunscreen with UVA and UVB protection. And how we know like it's UVA protected? It will be written like PA triple plus or PA 4 plus. It's that needed for this good sunscreen. And regarding the type of sunscreen, sometimes some patients, they say that they are using a sunscreen with high SPF, but they still get the pigmentation. So why it's happening? It's because that sunscreen, it may not be fully, like PA triple plus rating may not be there, PA 4 plus rating may not be there, because UVA is the thing that causes tanning and allergic reaction. Okay, so we also, while selecting sunscreen, we have to look for the formulation of the sunscreen. For oily skin, it's better to go for gel or fluid preparation. For dry skin, we can go for a creamy preparation. So, and regarding in children, it's always better to go for a mineral sunscreen like zinc oxide, titanium dioxide without any chemical ingredient. Even this mineral sunscreen is advisable in pregnancy and lactation. Okay. So, and how to apply sunscreen? As we all know, it has to be applied 15 to 20 minutes before letting out in sun. It has to be applied every 2 hours. That is the protocol. And when we sweat a lot after exercise, after swimming, every time we have to apply sunscreen. And how much to apply? Like for face and neck, 2 finger length unit. 2 finger length unit of sunscreen has to be applied for face and neck. So that's it regarding sunscreen.
Okay. Now you mentioned about sunburn. If someone gets sunburn, what are the immediate steps to be taken?
Okay, sunburn, sunburn is due to the UVB damage. So it appears as painful red patches on the sun exposed areas. Okay, so in some persons who are taking any medicines like photosensitive medicines, including any antibiotics, any anti-seizure medicines, they are prone for getting sunburn. And sun exposure in the midday light itself is a trigger. So just by applying sunscreen doesn't mean that we get a full sun protection. We have to use protective clothing, broad brimmed hat, and sunglasses while going out and all. So when we get a sunburn, immediately move the patient to a safety center, like to a shady region, and cool compresses definitely can be applied, and soothing lotion like cool aloe vera gel, moisturizer, calamine lotion, all will help to reduce the burning sensation. We can also give mild anti-inflammatory painkiller medicines, but better not to apply any steroid creams or steroid lotion. Okay, so he can take repeat like frequent cool bath that will help to soothe the skin. But with all the measures we take, again that area will turn black. There will be peeling of skin after 3 to 7 days, but slowly new skin will cover up that area. So sunburn, the most important thing we have to know that sunburn itself is a big risk factor for skin cancer. So better to take a good sun protection while going out.
So what's the connection between sunlight and skin cancer?
Yeah, the thing is, as I told you, like the sunlight itself contain both UVB and UVA, and UVB is a carcinogenic. Also, it can directly damage the DNA. And also, but in Indian skin, where dark skin, when there is a lot of melanin, it's the natural sunscreen. So it will reflect away, it will shield away all the UVB from the skin, from entering into the skin. So dark skinned individuals are much protected than fair skinned individuals. Okay, so skin cancer, there are two types of skin cancer. We can divide, like it can be melanoma skin cancer or non-melanoma skin cancer, including squamous cell cancer, basal cell cancer and all. So whatever it is, so proper screening of the skin itself is needed by the patient, and if he note any change in the appearance of the mole or any irregularity in the surface of the mole, any itching, bleeding, anything from the mole or any skin marks and all, or any birthmarks in the skin, better to consult a dermatologist and make sure if needed, we may have to go for biopsy to know everything is good and safe.
So doctor, since you are a dermatologist, we would like to know more about the services you offer at Al Hilal Hospital.
Okay, so we have a good radiofrequency cautery machine that works to remove the moles, warts, skin tags, and we have salicylic for acne treatment. We have salicylic acid peels, microneedling, PRP face, PRP hair, microneedling with radiofrequency. We also do intralesional steroid injections for like large keloid, large scars, hypertrophic scars and all. And we have a good hair removal laser machine. So fine. So these are the things.
So doctor, now can you explain about the allergic reactions due to sunlight?
Yes, we see a lot of allergic reactions in the summer. So it is seen as itchy, red, raised lesions over the sun-exposed areas, especially over the dorsolateral forearms, like this part, back of neck or face, because these are the more exposed sides to sunlight. So it can be like primary. So some persons, they are genetically prone for sensitivity reactions to sunlight, and it can also occur secondarily following intake of some medicines, including some antibiotics like tetracyclines, some antihypertensives, some medicines for diabetes. So all this can trigger itself the photosensitivity of the skin. And even application of hair dye itself is a photosensitive thing. Once you apply hair dye, some can get like itchy red rashes over hands, face, back of neck and all. And application of some cosmetics, the fragrance in the cosmetic itself can be photosensitive. So these causes secondary photosensitive reactions to sunlight. And sometimes some home remedies, including application of lemon, then garlic, ginger, that itself can trigger sunlight reactions.
So now can we discuss about acne in general, especially the causes and treatment?
Yeah,
That will be of much.
Acne is a vast topic. Yeah, it's a vast topic. To understand better, we can start from the beginning. How is acne occurring? It is due to the four basic mechanisms, like due to increased production of oil or sebum, due to the blockage of the follicles, due to the bacterial superinfection, and all this lead to inflammation in the skin. So inflammation in the skin leads to comedones. Comedones just means the closure of the oil ducts with skin cells. It can be open comedones, closed comedones. There can be painful pustules, large nodules. So that are the causes of acne. Also, there are other contributing factors of acne include diet. Diet plays an important role in worsening of acne in some individuals. Some medicines, including lithium, anticonvulsant medicines like phenytoin, steroids, all can contribute to acne. Stress itself, it causes increased stress hormones that itself can trigger acne. And excessive rubbing of the skin, too much rubbing, too much washing, and also sunlight exposure, that also can trigger acne. And even like contraceptive medicines. So there are a lot many factors like, and even vitamins like vitamin B12, high dose vitamin B12, vitamin B12 injections, and some patients are taking vitamin B12 injection, they may get acne. And vitamin B6, all this can contribute to acne formation. And so there is something also called truncal acne or back acne. So back acne means these acne lesions, comedones, raised pustules, everything is occurring on the back. So why we have to more concerned about the back acne? Because the treatment response will be lesser for the back area compared to face. And also there is more chance for keloids, means large scars, keloids and hypertrophic scars over the back area. So because back is a very vulnerable area because of the repetitive rubbing of the area, mechanical trauma to the area, friction of the area. So that's why some people are getting more of back acne. So in all types of acne, the common measures that we should take, like cleansing, very important, face and scalp, very important. If you have dandruff issues, we have to use any antifungal shampoo and all 3 times or 2 times in a week, because there is something also called fungal acne. So the difference between fungal acne and bacterial acne can be better after a dermatologic visit. They will identify whether it is fungal acne or bacterial acne, because the treatment will be different in both. So if you have back acne, better avoid applying hair oil over back, hair oil over scalp. And once you do shampoo, apply shampoo or conditioner, it has to be properly washed off from the back. And like after coming from exercise or doing after gym and all, better to remove the sweaty clothes then and there itself. Better to avoid using loofah, scrub bath and all. So that's for the back acne and the treatment. Yeah, for face acne, you have to use a good cleanser. If much oily skin, you have to use a salicylic acid or glycolic acid cleanser. If normal to dry skin, you can use a mild gentle cleanser. And more importantly, like as I told previously, you have to use moisturizer at night, especially. Even for the acne skin, you have to use a moisturizer, gel-based or fluid-based moisturizer, and a sunscreen, like gel-based or fluid-based sunscreen in the morning. And yeah, so coming to the treatment, what we have to understand is the treatment response to acne varies from person to person. Some shows very quick response, but wait for just 2 to 3 months to assess the efficacy of treatment. And our aim is to reduce the active lesions. It may not be the complete clearance of the acne lesions, because there may be underlying some hormonal imbalance or some medicines taking or any dietary changes and all. So it will always take time. So the treatment protocol includes like topical treatment, internal tablets, and like other physical modalities of treatment. So the topical treatment include creams like clindamycin, benzoyl peroxide, retinoic acid, adapalene, salicylic acid, azelaic acid. There are a lot of topical creams. So regarding benzoyl, adapalene and retinoic acid, so retinoic acid has to be used very cautiously. It has to be applied only at night. When we start a retinoic acid cream, apply at night, wash after half an hour when the first time application. If it's okay, you can keep for 2 hours. Slowly increase the time duration. And after washing, you have to apply some moisturizer, because retinoic acid itself can be a bit irritating. It can cause dryness, scaling of skin on the next day. So it has to be a bit cautious on applying that. And regarding azelaic acid, it's a good component. It can be used even for pregnant women. It's good for acne marks, active acne lesions and all. So, and we all know about salicylic acid. It helps in the reduction of open comedones, closed comedones. So fine. So we can combine all these topical measures together. And if it is unresponsive to the topical measures, we may have to go for intake, tablets, systemic treatment, including antibiotic. Antibiotics may have to be taken for 2 to 3 months sometimes. And if there is any underlying hormonal imbalance, in case of women, if there are any increased male hormone features in the body like hirsutism, that means facial hair, or hair loss, or seborrhea, or worsening of acne, or irregular periods and all. In that case, it's good to start hormonal contraceptive medicine. So if the woman, she also want to adopt a contraceptive measure, it's always good to start. So it should be combined oral contraceptive pills, because some patients, they come with worsening of acne even on starting the contraceptive pills. So that is because sometimes the contraceptive pills may be containing only progestin pills. So actually combined oral contraceptive pills contain both estrogen and progesterone. If it is just progestin, it can cause worsening of acne. So that will be decided by doctor, and it may have to be taken for 3 to 6 months to assess the efficacy of the treatment. And so fine. So that's about the hormonal measures, and the final treatment will be like isotretinoin. It is only FDA approved medicine for large nodulocystic acne, acne with scarring and all. But isotretinoin should be started after a much counseling, cautiously, because before starting isotretinoin, we have to do blood test including liver function and lipid profile. It has to be screened every month while on isotretinoin. And in women of childbearing age, better to avoid, because a woman has to adopt at least 2 contraceptive measures. If a woman gets pregnant while on isotretinoin, sure birth defects will be there. So if one is planning to get pregnant and all, at least stop isotretinoin a month before. So use cautiously, and the tablet itself, after taking it, cause dryness of the full body, dryness of our face, dryness of lips and all. And in those with mood changes, depression, it can cause worsening like mood. So it is not advisable in those who have depression or mood changes also. So very judiciously, very cautiously, after much counseling, has to start isotretinoin. But it is a one that gives very good results. It reduces scarring, it reduces complete like large nodulopustular acne and all. So that is it. And there are some like physical modality of treatment, including peels. We do peels here. Salicylic acid peels. We are applying 30% salicylic acid peel. So it helps to remove the comedones, even the active acne lesions and all. And there is, if not responding to salicylic acid peel, we also have MNRF, microneedling radiofrequency. So coming about the acne scars can be treated. If superficial scars only, we can go for chemical peels like salicylic acid peels. But the treatment protocol will be different. If it is a deep scar, there are different types of scars actually, rolling scar, box scar and all. So the treatment plan will be decided by the doctor. Sometimes multiple modality of treatment may be needed for a single patient. So for a deep scar, if a much depressed scar, we may have to start with the subcision. Subcision is something we are inserting needle into the scar and we are breaking the fibrotic strands that is tethering the scar to the underlying skin. So that we may have to first start with subcision. Then we may have to go for MNRF, it is microneedling RF. So in both microneedling and microneedling RF, what it is done that multiple microneedles, that is fine needles, are giving controlled trauma to the skin. So when there is they are creating multiple channels into the skin. So by the skin's natural healing capacity, there will be more buildup of collagen, elastin, ground substance. So by microneedling, it will help to the skin gets tightened, thickened. It will reduce laxity. So it can be done for acne scarring. It also can be done to reduction of aging and all. And we have MNRF. MNRF is microneedling with radiofrequency. That means along with the microneedling, radiofrequency is inserted, is again charged into the scars to the underlying skin. So radiofrequency itself is a stimulant. So it will help in the buildup of more collagen, elastin. So it will help to much tighten the skin, reduction of the acne scars and all. And right now, since we have created micro channels in the skin, on the top if you apply any serum or PRP, that gives more wonderful results. So PRP, we all know PRP itself, it's a pack of growth factors. So it itself helps in the production of collagen and elastin. So MNRF with PRP for acne scars have good results. And if the acne scars is that much depressed, depressing scars, if the patient is having, then we may have to go for fractional carbon dioxide laser, then scar revision, excision of the scars, sometimes fillers into the scars, all have to be done.
Now, doctor, can you suggest a diet plan for acne-prone persons?
Okay, so as per the new studies, 2 major food items can trigger acne. One is high glycemic diet and increased milk consumption. Okay. Even the whey protein, the protein that is derived from the milk itself can trigger acne. Okay. So as we all know, high glycemic diet, it's because of the adoption of the more Western lifestyle. So it includes better to avoid burger, white bread, French fries, fruit juices, even white rice. So all these are high glycemic. So we can adopt low glycemic diet including wheat, whole grain bread, fruits, vegetables. More consumption of fruits and vegetables helps in the reduction of acne. And so more intake of fruits and vegetables helps in the reduction of acne. Also we can include nuts, all type of nuts. So that's a diet plan for acne.
Can we treat acne completely?
It's a good question. We can't treat it completely. The aim of the treatment is the reduction of the active acne, not the complete clearance of acne. Because if there is any underlying factors like any hormonal imbalance, any medicine intake, any change in diet, stress, there are a lot of factors in acne. So for most, they get much reduction of the acne, but the thing is, we may have to continue the maintenance therapy of acne. That is really important. Like even after one gets a clearance of acne, one has to use some maintenance treatment like retinoic acid. These days, retinoic acid, retinol are getting much hype. So better to continue like some salicylic acid or glycolic acid face wash if much oily skin. Use retinol at night or retinoic acid at night. So like a maintenance is really important for acne prone skin. Okay.
So doctor, what is your takeaway message for our viewers about the skin infections?
Summer skincare, as I told, it's very important. Proper cleansing, 2 times cleansing, face cleansing, scalp, at least every other day we have to wash scalp. If dandruff issues, use a good shampoo, use a good sunscreen, apply moisturizer, replenish with the moisturizer at night.
So doctor, before we wrap up, what is your takeaway message for our viewers?
Yeah, in this summer climate, always stay hydrated, drink lots of water and eat colored fruits and vegetables because that helps to provide much beta carotene. That itself is a sun protection factor that gives much sun protection. So beta carotene containing vegetables and fruits include carrots, spinach, tomato, which contain lycopene, pumpkin, all those colored fruits and vegetables. And also vitamin C, that's helpful. That helps in the, it's a good antioxidant. So helps in prevention of damage by the UVB radiation and all. Along with that, proper cleansing very much needed. Cleansing of full body, face cleansing 2 times or 3 times with a good face wash. Use a good moisturizer and a good adequate sunscreen.
And finally, what do you have to say about Al Hilal Healthcare?
Fine. So in Al Hilal Healthcare, we have a very good supporting staff and I am very thankful and really proud to be a part of Al Hilal Healthcare Group.
Thank you, doctor. Thank you for joining us and giving us a lot of information about
Thank you so much.
Skin infections in summer. Thank you once again.
Thank you.
So viewers, I hope this episode was very informative. For more informative episodes, tune into BMC Global Live Al Hilal Health World, Nothing But Lifestyle, every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.
all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.